I take it he was agreeable?
He didn't really have a choice.
Has he been infected?
Oh yes, most certainly.
This plague, the rioting is intensifying to the point where we may not be able to contain it.
Why contain it? Let the bodies pile up in the streets. In the end, they'll beg us to save them.
I've received reports of armed attacks on shipments. There's not enough vaccine to go around, and the underclasses are starting to get desperate.
Of course they're desperate. They can smell their death, and the sound they'll make rattling their cage will serve as a warning to the rest.
I hope you're not underestimating the problem. The others may not go as quietly as you think.
Yes, we're tracking H1N1. It's also known as swine flu, but that was a mistake. We never should have called it that. It's hurt the pork industry, and we'll never say it again. The military is expected to put together teams across the country to deal with a possible outbreak this fall. Did you hear that, Jessica? The military, I mean, they have some serious concerns about what's going to happen in the fall with this flu. Because we'll have two flus at once, obviously, regular old every year flu, and then this, pig flu.
That H1N1.
Yeah, in case the government asks FEMA for help, the government will be ready there with the military. We're told it's as health officials race to get vaccines ready. The U.S. government has just gotten 20 million doses, and we're told it could be getting ready to start giving those shots by October. Even though the trials for these drugs hasn't even begun yet. Just minutes from now, a panel from the Centers for Disease Control and Prevention in Atlanta is expected to hold a news conference in Atlanta and give its recommendation on how the new vaccine should be handed out. Keep an eye on that news conference, and we'll let you know exactly what happens and all the developments from it. Our Brian Wilson is covering this. Brian, the military getting involved, that seems kind of drastic.
Well, I think it is dramatic. Fox News has confirmed that Northcom has a proposal sitting on the desk of Secretary of Defense Robert Gates that would authorize the military to back up FEMA should there be an H1N1 pandemic. The proposal comes from Northcom Commander Victor Renoir, who wants permission to set up 5 regional military teams who will respond if FEMA says it needs help. One assumes this might be necessary, Shep, if there were, for example, mass quarantines.
Well, there's a hearing today in the Senate on preparing for H1N1. Where are they with this thing?
Well, the H1N1 vaccine is not completely ready. They do have some test doses they want to start testing. Won't be ready for a while, but they do begin a campaign in the fall. Take a listen to what was said today.
Clinical trials will occur over the next 2 months. But I think in the next month we will have some additional information about the type vaccine that we would use. And within the next 2 months we will have a great deal more information about the actual virus itself and whether it has mutated as it has moved from the southern hemisphere back to the United States.
And Chef, those who should be at the front of the line, adults 19 to 24 will begin to hear because it seems that the H1N1 hits young people the hardest.
Yeah, I guess they saw that here in the United States, but were they seeing that in outbreaks in other parts of the world as well? I mean, we've learned a lot about this thing recently.
Well, the problem is it keeps changing, and that is the real issue here, is that this one morphs and mutates and comes back in different ways. So they have to be very careful, but they think right now that the people at greatest risk are young people 19 to 24.
All right, Brian Wilson on Capitol Hill. Of course, reminder, we are tracking H1N1. Can we play that animation again? There we go. Be very afraid.
Right now, the U.S. government apparently is not winning. We've been hearing warning after warning about a second wave of the H1N1 virus when the flu season hits North America this fall. A startling report confirming that many people's worst fears just coming out that we're not yet ready for this. Barry Snow is going to take a closer look. What are we learning, Mary?
Well, the bottom line of this report is that the United States is not ready for a more severe round of swine flu. The Government Accountability Office concludes that many gaps in pandemic planning and preparedness still remain. Among them, the GAO says federal, state, and local agencies need to coordinate better, especially when it comes to private sector. It also cites a lack of clarity when it comes to who's responsible for things like state border closures, should they happen, and distributing vaccines. And another issue it flags is being prepared for health services and supplies, especially it says if there are more patients going to hospitals than there are beds. Now, we asked for a response from the Department of Homeland Security and Health and Human Services, since these two departments were targeted in the report. They challenged the findings, saying our aggressive coordinated efforts to plan for and respond to H1N1 flu have not wavered since the first signs of the outbreak emerged. Working with our federal partners as well as state, local, tribal, and territory officials, we're taking the critical steps necessary to ensure the nation is prepared for the fall flu season. Well,
And Mary, this report comes from the Government Accountability Office, this nonpartisan government office, so it's got good credentials, good people working there. What do we know? What about the latest on a vaccine or two vaccines that may be necessary?
well, at this point, the clinical trials are just getting underway. They'll determine how effective these vaccines will be, how safe they'll be. So health officials at this point don't expect to start a mass vaccination program until early November. Now, an advisory panel just put out guidelines yesterday, and at the top of the list of people who will be a priority for getting vaccines are pregnant women, healthcare workers, first responders, people with children under 6 months old, and when it comes to children, those 6 months and over to about 4 years old will be on the top of the list as well, along with children with chronic medical conditions. When you add up those groups alone, we're talking about 42 million people.
So obviously the vaccine is not going to be ready when a lot of these kids go back to school at the end of August, early September. So we got some work to do. All right, Mary, thanks very much.
Had to endure much, you and I, but soon there will be order again. A new age. Aquinas spoke of the mythical city on the hill. Soon that city will be a reality, and we will be crowned its king.